Welcome, everyone. Today's focus is on the Niagara Health Navigator app. So back in October of 2019, which seems forever ago, we went live with our first version of the Niagara Health Navigator app. And the purpose of this was to be able to provide more ease of access to digital healthcare and health services across the Niagara region. So we did start with a smaller subset of tiles, which are the applications that sit within the platform. And gradually we've grown. And now we are actually now doing an initiative with the Ministry of Health and 3 other hospitals, St. Joseph's Healthcare Hamilton, South Lake Regional Healthcare Center, and North York General Hospital. And this is a patient digital identity authentication and authorization project. It started off just as a small pilot with these hospitals, and now we've recently been approved to expand it out further. So our goal is to make this more of a provincial approach where patients can actually access healthcare digitally, not just generic items like wait times or things like that patients do not need to have to be authenticated, to those ones that actually share your personal health information so you can manage your appointments, things like that. Okay, so Niagara Health is a regional healthcare provider with multiple sites and a growing network of community-based. As a community-based academic center, their focus is on teaching, learning, research, and innovation, and continually improving healthcare and making differences in people's lives. Their team consists of more than 7,300 employees, physicians, and volunteers. So it's made up of apps that put patients at the center of their care by empowering users to manage their health information and access health services from convenience of a mobile device. We initially featured these apps. So it had a Niagara Health newsfeed, which provides you with all the most recent information for Niagara Health, emergency wait times in urgent care centers, rate your Niagara Health experience, thank a staff member, express a concern. So we really are interested in your feedback and improving our care for patients. We want to make sure that we do everything we can to improve healthcare. So it also has a list of our sites and services, as well as a tile for app support and feedback. And here is where you can actually, if you have a suggestion of an app that you'd like to see on the Navigator, or if you have some issues, you can actually contact us through that tile. Subsequent releases have included mental health and addiction resources, COVID-19 information tools, and Niagara Health Foundation updates. In March of 2021, both Niagara Health and South Lake Regional Health Center were the first 2 of 4 hospitals that went live with the Ontario Trusted Account. And the Ontario Trusted Account is Ontario's first patient digital identity, and it allows you to prove yourself like you would in person, but virtually, and allowing you to create an account and be able to do things like manage your appointments, see diagnostic imaging results or reports, and future iterations will actually include access to provincial databases such as OLIS, which actually has lab results. So you'll be able to see your lab results, see a more fulsome patient record. And we are also looking at services such as Seamless MD, which is a tool that allows patients to see pre and post surgery discharge information that's specific to them and their care. So in order to download the Navigator, there's 2 ways you can do it. If you have an Android, you can go into the Google Play Store, and you can actually tap on the Play Store icon and look for Niagara Health Navigator, and then you can select install and open. And then from an iOS device, it's very similar. You're going to click on your Apple app, which is up here, and click on Niagara Health Navigator and select the tile and select Get, and it will prompt you likely for your Apple ID unless you have it set up not to do so. And then you can tap the Navigator app to open it. So if you're having an issue with downloading the app, we do have a phone number that you can reach out to, and it is our Niagara Health Navigator specific support line. Since we've gone live, we've actually created its own help support line, and that extension is 49888. So you would dial the main line, and then when prompted, dial that extension, or you can reach out help@niagarahealthnavigator.ca, and that is those 2 numbers are the exact same links that are on that app support and feedback tile that I was mentioning earlier within the app. Okay, so starting with the app, and I'll do a real life demo after this, but the first thing will happen the first time that you download the Navigators, you'll see a prompt here notifying you about a new way to access health services in your area. And what this is this is the prompt that'll lead you with a bit of information and then prompt you to go in to create an Ontario Trusted account. If you don't want to create an Ontario Trusted account at this time, or you don't have your information available, you can just select skip. And then later on, you'll see a tile that says My Account, and you can actually join via that manner. To create an Ontario Trusted account, it does require a few pieces of ID. It requires your health card, as well as if you have one of the big 6 banks, you would be able to sign in and create one using the big 6 banks as your verifying ID. We are in the process of expanding that way to verify yourself. You would still need your health card, but instead of using Verified Me, which is the service that does the banking, even Verified Me does not keep your banking information. It just passes it through to your bank when you log in. They provide a tile back to say, hey, this is who it is, and gives you your name, provides your name, your date of birth, and your postal code. And then that becomes part of your account. And through this whole process, you have the ability to accept or decline. So this is all owned by you. So as mentioning, it talks a little bit more about how to simplify access to your healthcare. So the goal is to not have to remember all those usernames and passwords. The goal is to eventually have a way that you have one ID that you can remember, and it's hooked into your device ID, where that way you don't have to remember lengthy passcodes and such. And it will allow you then to be able to access various healthcare services using that same ID. But again, it's only connected to those health services if you say, yes, it's okay to connect it. So if you have an account and you haven't logged in for a while and it's logged you out, you can use continue for your existing account. However, for the first time, you would click on set up for the first time. And then it would tell you how long. It does take a few minutes. The first time you sign in is a little bit cumbersome, and that's because we want to make sure that you are who you say you are. We want to protect your identity. So it does take a little bit of time. However, once you do it once, it generally, unless something happens and you log yourself out, you can generally just go ahead and enter your PIN code or your thumbprint or whatever secure ID you have on your device and continue to go into these services using that ID. So it does make it easier after the first time. So it's definitely important to make sure that you read these little tiles as we go along. But you will also need to make sure that your Wi-Fi or your data connection is strong. So if you're in a spot where you only have 1 or 2 bars, you may need to move. So having your documents ready, this is definitely important to have to be able to ensure that you are who you say you are. We use a solution called Verified Me. It is by a company called Secure Key Technologies. However, it was recently taken over by Interac. So Interac they're in rebranding, so we haven't changed anything yet as far as our tiles go. However, basically what they do is they take your big 6 banks and they allow you to log in to verify yourself using your banking login. And that allows us as step 1 of 2 to verify that you are who you say you are. The next piece that we need is your health card. So we need to make sure your health card is valid. And then the health card itself, though, we do maintain your number. We don't maintain some of the other information within the health card, but we do maintain your health card number and version code. And that helps us to verify that we match the data within the back end that's in the healthcare service with yourself. The Ontario Trusted Account, what is it? It is the first patient digital identity authentication and authorization service in Ontario. And by creating an account, users can securely access health services and information through approved service providers. Patients can then grant consent to share information with approved service providers to access health services and information. And the service allows users to have a single credential that will lessen the need to remember additional usernames and passwords. The Ontario Trusted Account Service is hosted by Niagara Health and sponsored by the Government of Ontario. Strong physical and technical safeguards are in place to protect the privacy and security of Ontario Trusted Accounts. These include protections against loss, theft, revisions, misuse, copying, and disclosure. if you had decided that you didn't want to create your Ontario account at that time, or if you did it and you need to access your account at a later date, maybe you have a new version code that you wanted to update on your account, you can actually access everything through this My Account tile here. And within the Navigator itself, you'll see at the top, it does cut off on some of the devices. So I'm going to back a slide just quickly. This leads up to here at the top, right beside your Navigator branding, is Twitter. So at any time, you can actually click on it and enter in your Twitter feed. Look at it. It'll take you out to Twitter if you have a Twitter account. If you don't, you can just look at them without signing in. And then, of course, we have our COVID-19 apps, which are all going to give you the most recent information that Niagara has on COVID-19. But there's also a spot where you can actually go in and get your results. You will also see things like news feeds, wait times, information about our new South Niagara project, which is the new hospital that we are building. And you can also have services like the Appointment Manager app, healthcare options. We also have Pocket Health. So for those of you who have used Pocket Health through other services, not necessarily even Niagara, like the Greater Niagara Medical Imaging, once you've signed in once through Niagara Health and have an Ontario Trusted account and access Pocket Health the first time through your Ontario Trusted account, if you do already have it signed up through Greater Niagara Medical Imaging, you can access that one as well. And there's also services like mental health and addictions that we want to be able to provide access to patients and citizens across Ontario. So if your son or your family member is having some issues and you need someone to get you support right away, this tile gives you the list of information of services that can help you with that. And then we also have other tiles around our Niagara Health Foundation, a caregivers app. So support for caregivers. It's not always just the patients. Caregivers also get tired and need some support. So we also want to make sure that we support them. So we provide that information. And then as you saw earlier, we have other tiles like rate your experience at Niagara Health, provide information if you'd like to thank a staff member for their service or express a concern about a staff member or an area. And so there's tiles for that as well. There is an area here where you can access all of your COVID information. This one here, just a disclaimer too, if you are having issues with this tile, so once you get in, if you put in your health card information and you can't get your results, that is the Government of Ontario. It's their site. So unfortunately, you do have to reach out to them directly. But we do our best to provide as much information as we can for you so that you can access and be kept up to date on COVID. As mentioned, under the news and updates, we have our news feed, our South Niagara project, and our wait times. And this one I found personally really helpful. All right, and then this is a little bit more detail about the wait times menu. And just so everybody is aware, but we did recently close our Douglas Memorial site right now to redeploy staff to help out with COVID initiatives. So if you do go into the app, you won't see Douglas Memorial on the list right now. Once things calm down and we open back up again, it'll reappear. It also gives you other healthcare options too. So if you are in a pinch and you need to reach out to telehealth or Healthcare Connect or Healthline, we also provide that information as well. So on the services, as I mentioned, we have Appointment Manager and Pocket Health. So Appointment Manager, it does not let you book appointments at this time. As we add more clinics, that will open up, but it's all diagnostic imaging across Niagara. And because there's so many complexities and multiple appointments, we opted not to allow you to rebook your appointments just because it does get convoluted, because there may be times where you have to have your second appointment within so many hours of your first appointment. So we do rebook them for you, but it does give you the number to reach out and reschedule your appointment or cancel if need be. But it allows you to remotely answer all of the questions that you would ask at the registration desk when you attend. And then it allows you to check in when you get there. So when you get to the hospital, it's what they call geofence, meaning it looks for you to be in the vicinity of the hospital, outside in a parking lot or a nearby street. And you can open the app and it'll automatically check you in and allow you to arrive. And then what happens when you go in, you talk to your screening person, because we do have screeners at the door, and you let them know that you've checked in using your Appointment Manager app for diagnostic imaging. And if that is successful, then you just go ahead and you can go ahead right to your appointment. You don't need to stand in line at the registration desk. We also have Pocket Health, as I mentioned, that has the medical imaging and reports from Niagara, and healthcare options. So what this does is takes you to our website, which provides a link for you to be able to see what appointments or what clinics and where they get flu shots, any of those kinds of things. These are all within this app. So it's a really good little tool for you. Mental health and support addictions. This is a great tool for those that may need some immediate support or need to go to someone immediately. So if you have a child, for example, where do you go if you need some support during a crisis? It actually gives you the contact information for places like Pathstone or when you should go to the hospital versus another clinic. And then we have our sites and services, which basically gives you a list of what services are at each site across Niagara Health. So not every hospital has the same services. So this gives you a list of where services are located. So this is the Appointment Manager app. So this allows, the first time you actually go in, you'll get this little preamble page. And what happens is when you click on it, it takes you out to the Appointment Manager app. And the first time you click on it, it's going to ask you to download it. And then subsequently, it'll ask you to open it. Unfortunately, it's not a embedded app, so it is a separate app, but you can access it through your navigator. So this is another tool that we have, our Niagara Health Foundation. So it's not just obviously donations. It also takes you out so you can get more information about our foundation and the work that we're doing. And then, as I mentioned earlier, it's not always just about the patients. It's also about those that support patients. So we do have a Caregivers app, and there is a phone number and a website where you can go in, you can get information as a caregiver to be able to help you to get the information or the support that you need to be able to take care of yourself as well as those that you're caring for. These two very much act very similar. So basically what you can do is you can either call and leave a message at Patient Relations, or you can actually click on the send a message and it'll open up a fillable form where you can enter in your information, your name, your email address or phone number, however you prefer to be contacted, a little bit of information about what you're contacting about. And then it actually asks if you would like to provide, if you know where you got that support. So if it's in our women's and babies section, for example, you can actually put that information in, and then we can share that information back with that group. So especially if it's an area of concern, I mean, obviously everybody likes to hear the great, but the bad as well is very helpful for helping us improve the experience that you have. And then the Rate Your Experience is a series of, which you'll see, it's a series of questions just for us to be able to track how well we're doing on patient visits to Niagara Health. And then, of course, the app support and feedback tile. So these are all within the same row within your navigator. So as mentioned, you can see in the Rate Your Experience, you basically just select your site. And if you know which unit that you went to the hospital for, then you can actually click on that, or you can put in some free-form information. And that just allows you to text in here. And then you can rate the experience from a 1 to 5-star rating. And then once you're done, you can put in any additional notes, and then you can save and continue, and it'll basically allow you to then exit the survey. All right, so app benefits. So if there's any of the interfaces that you do not understand or that you find that they're not as user-friendly, please provide that feedback to that the help at niagarahealthnavigator.ca, because we are always looking to improve. And of course, you're only a tap away from getting multiple services and resources that can help improve your experience with healthcare and health systems within Niagara. This is the Niagara Health Navigator staging app. So this is the test app, but it's a good way to provide a demo to you on how you can sign up for an account. So when I click on the app, this is what you would see. If I ever wanted to just close out, maybe I'm not interested in signing up right now, or I don't, as I mentioned earlier, I don't have my stuff with me, I can just hit the X and it would take me to the navigator. So within the navigator, you can see the various tiles. So I can do something like see my case reporting, and it can actually take me right into Niagara Health's website where I can look and see how many cases that I have in Niagara Health. If I hit the back button at the top, it takes me back to the home screen of the Navigator. And then we have the other services that were mentioned as well below. And there is a bit of scrolling, but it was the only way we could fit as much information as we could on these tiles. If you have a bigger device, it's not so bad. But if you have a tinier device, there is a bit more scrolling. So I'm going to go ahead and sign up for an Ontario Trusted account because of the fact that I'm going to want to share with you how to manage an appointment. So I'm going to click on my account. And it's going to ask me if I want to set up for the first time or continue with an existing account. So I'm going to set up for the first time. And again, it's giving me the preamble that it's going to take me 5 to 8 minutes. And right now it is only accessible to those that are 18 years or older. We are looking at providing availability for delegate access or substitute decision making, but we know there's a lot of legal that goes behind that. So we have to do that in piecemeal. We needed to get one thing up at a time. So again, it talks a little bit about verified me and about the big 6 banks. In our case, this bank is going to be called My Bank because it's a fake person, but and also talks about your health card. So once I sign up, it takes me over to verified me so that I can sign up with one of the institutions. We have a new one here called My Bank. So that's my bank account. And I'm going to type in my email that I use to sign in for my bank account. So in this case, I am Case in Lancaster. Okay. So that's my email. And then my password is the password that I would sign into my banking. In this case, it's password. And we sign in, and then it's going to ask you, depending on your bank, you may have dual factor authentication. And what that means is your bank will send you a little code via text to say, are you sure this is you that's signing in? And it sends it to your phone and you enter in that code. So in this case, because it's a fake one, I don't need to do that. I'm just going to hit OK. And then it presents me with the information that's mine. So for me, it's giving me my name, my address, my phone number, my date of birth, and my email. So when I hit OK, it's getting things ready. There we go. Now it's going to ask me if I want to share this information with the Ontario Trusted account. So when I click on these little arrows, it actually will tell me what information I'm actually sharing. And then I can go up and verify me. It just tells basically what verify me is: a secure identifier used by an online service to help verify your identity. So I'm going to agree. You can see the bar at the top. It's a little slow in our test system. It's not that slow in real life. Normally, I would take the time to read this, but because it is lengthy, I'm not going to show you the full thing, but you can definitely read them. The website, it's called mytrustedAccount.ca. You can go in there and you can read our terms of use. You can read our privacy policy. You can watch a little video. You can learn all about the Ontario Trusted Account without having to do anything to sign up yet. So at any time, if you wanted to do that before you sign up, you're definitely welcome to go ahead. So I'm going to agree to all the terms. And now there's another section here. So the Ministry of Health takes your information in order to verify you are who you say you are. So they have what is called the consent to collect and use disclosure of your health information by the Ministry of Health. So basically they take your health card, your version code, your document identifier number, which is the little number on the back of your card. And they take your date of birth and your postal code, and that information then goes across to them, and they provide us with a yes or no that you are who you say you are. So it's up to you if you want to do so, but in order to use the service, we do need to have your consent to be able to share this information so we can verify you. So I'm going to tick on the box by touching it, and I'm going to hit continue. And this tells you what is the information that is provided by Verified Me. So again, it's your first name, your last name, your date of birth, and your email. And at any time, if you click on this, how do I update my information? Basically, it's going to tell you to go to your bank. But anytime, if I need to change my email address, I would need to go to my banking, or if I needed to fix my date of birth or postcode, you go to your bank to fix it. And then the next time you sign in, it would populate over to us. Of course, you always need to keep your hospital up to date as well. So the next time you go in, you just update your hospital information with them. So here I'm going to enter in my Ontario health card number. Any of these little question marks give you information about what each field is. 1399891-264. And my version code is EV. And my document identifier is PT1399. And again, these are fake numbers, so I'm not concerned about sharing them with you. 893-399-893. And my postal code is K1V1A2. And this field has since been removed, but it used to, in order to be verified through OLIS, which is where your lab results are, they used to ask for whether you are male or female. Now they don't ask that, so that will be gone in our next iteration. So when I submit for verification, my identity has been verified. So I can hit continue. And I will open this page in the Niagara Health Navigator. And my next step is to unlock my Ontario Trusted account. So there we go. So now my account is ready to use, and I can view my Ontario Trusted account. All right. So now you can see that the very first thing it takes me to is where my account is. So my name is Kaysen, and I'm verified by Verified Me. And as it mentions, this is your Ontario Trust account, and it's funded by the Government of Ontario and hosted by Niagara Health. If I go into settings, I can actually delete my account at any time. I can log out, or I can actually manage my login information. So if I click on that, it'll do things like allow me to see my account details and edit my health card information. Okay. Return to my account and my account. And so now I'm going to hit back and take myself to the navigator. So I'm going to show you the Appointment Manager app. So if I click on the Appointment Manager app, as mentioned, it takes you to the preamble page and asks you if you want to create an account or you want to manage your appointments. So I'm going to go to my appointments, and it's going to take me out to the app. I have downloaded it. There might be a new version. That's probably why. So now I can open it. And the first thing you have to do is you have to enter in your hospital code. So everybody for Niagara Health, I'm going to be the test system, but in the real system, it's NHAPPT. And in this case, it's NH test because we're in the test system. Then when I hit next, it's going to ask me for my date of birth. There we go. I am going to, you can either sign in using your PIN code or your date of birth, or you register using your Ontario Trusted account. So in this case, we're going to register using the Ontario Trusted account. So I click the button. It's going to ask you if you want to do this. And of course I do. And then I'm going to open it, and it's going to take me over to the consent. So this is where I mentioned that it's up to you whether or not you want to share your information with that app. So in this case, I do want to share my information with the Appointment Manager app. So the details, if you hit details, it tells you what they're sharing. So you're sharing your date of birth and why you're sharing it, your health card number and why you're sharing it, and your name as well as why you're sharing that. So I'm going to consent. And at any time, I can go back into my account and I can remove that consent if I no longer want to share my consent. Okay, so I'm going to make this a little bigger. And this is because of the version of my app. So when I hit continue, I don't need it to send me notifications, but you can allow it. It'll let you know if there's an update or whatever. So in order to sign in, I need to enter in my date of birth. So my date of birth is November 3rd. So I'm going to scroll to November 3rd, and it's 1988. Okay, and then I hit OK and log in. Okay. Just asking if it wants to sync with your calendar. So it can sync with your calendar, and then your appointment can go into your phone calendar. So now you can see my appointment. So here I have an appointment, an ultrasound appointment today at 3:00 p.m. And I can either confirm the appointment, I can cancel it or reschedule it. If I click on the cancel or reschedule, it just gives me a phone number at this point where I can contact to actually do so, or I can confirm it. So I want to be able to check in still. So I have an appointment at Niagara Falls Ultrasound, and at 3 p.m. today, January 14th. Normally what happens is you get a phone call, and if you provided a cell phone number at the time of registering, it'll also send you a text message. So it reminds you of your appointment and any prep work that you have to have. So if you have to drink a liter of water and hold, it tells you what you have to do. Or if you have, don't wear metal, whatever the case is, it tells you to do so. So when I hit confirm, it gives me a bunch of questions. And these are what we call, first it asks you to double check your information. So your address and such. If the information is correct, it'll let you to proceed. Otherwise, you will need to go to registration. So I'm going to click yes. And then the next one, it'll ask you if you want to share your information with your family physician. Again, if you don't want to do so, you do have to go to registration, just because there's stuff that they have to do on the internal side of things or in the health information system. But in my case, I'm going to share it. So I hit yes. And now I'm going to get a series of questions around what they call IPAC questions. So have I been vaccinated? Have I traveled outside Canada in the last 14 days? Have I had close contact with someone who has traveled outside Canada in the last 14 days? Have you had close contact with a confirmed case? I'm trying to hit no, there we go. Have I tested positive? Do I have a cough? Do I have difficulty breathing? Have I had a fever, chills, sore throat? And there's a lot of questions, so you just keep answering yes or no accordingly. Now, most of these do not stop you from proceeding to registration. There's only a few that will stop you. And that's really if we worry that you are a falls risk, because we want to make sure that you have the assistance that you need to go to the appointment. So we would get you to go to registration so they can band you and get you the right assistance that you need to get to your appointment safely. So I'm going through and I'm going to answer no to all of these questions, all about, do you have rashes? Do you have MRSA? Have you had VRE? Have you been hospitalized? Have I been living in a shelter? Am I feeling dizzy? So these are the ones. If I answered yes to any of these, I would get stopped. So am I dizzy or having problems walking? Do I walk with a cane? Do I need assistance to my appointment? Am I 70 years of age or older and have experienced unexplained delirium or falls? So once I've done that, I'm going to hit continue. And it'll tell me, thank you for confirming my appointment. Please be sure to open the app and check in upon arrival at the hospital. Please do not enter the hospital until 15 minutes prior to your appointment. So when I hit continue, what will happen is when I refresh my appointment, it says I have a chance here to say I'm here, or I can cancel or reschedule. So in this case, I'm here. So I'm going to click that button. And unfortunately, you can really only do this if you have an appointment, but this is how it would work. So it's looking to see if I'm actually in the vicinity. And then it tells me that I'm successfully checked in for my appointment, and I can go right to my appointment. So now I don't need to go to registration. I can just go right into the diagnostic imaging department once I've passed screening. And then you can see on my appointment, I've arrived. I confirm my attendance at whichever time, and I have actually checked in that I'm in the parking lot. So I can do this for all of my appointments. There can be multiples. And we did it for with one hospital code because it allows you now to see if you have an appointment in St. Catharines and one in Niagara Falls, you can see those without having to change anything. It'll all give you that in one view. And that's pretty much it. So if I close out of here, if I hit my little home button and then I go back to my navigator, I can get back and back. I can get back to my navigator and just see all my regular things like wait times and such.